I'd like to recognize Ms. Kayla Booth. As I said earlier, she's a Huntington's disease patient and a caregiver.
I want to recognize and thank Kayla Booth, who is here today to testify on her experience with Huntington's disease. Kayla is a constituent of mine from Cecilia, Kentucky. While not advocating for patients with Huntington's disease and their families, she often can be found face painting at community events. Kayla is the fourth known suspected generation of HD in her family and is a strong advocate and voice for the Huntington's disease community.
Thank you for the opportunity to share my family story and the story of so many HD families. My name is Kayla Booth. I am 34. I am the fourth known generation in my family to have Huntington's disease, but only the second to be officially diagnosed. I am a patient, I am a caregiver, and more importantly, I am a voice. Today, I am a voice for the HD families who do not have one. Over the years, I have taught myself to emotionally disconnect. This allows me to be able to separate the Huntington's disease from the person. Twice I have watched a broken system turn a devastating situation into an almost unbearable one. Huntington's disease is a rare inherited disease that causes degeneration of the brain. It affects each patient differently. The symptoms are different, the progression time is different, but what is not different is it is fatal and there is no cure. Unlike other neurological diseases, symptoms of HD typically develop in the prime of a person's life, their 40s. These years are typically a person's highest earning income years, middle of raising families, or planning for retirement. However, HD disrupts all of that and physically, emotionally, and financially drains families. In the late 90s, early 2000s, when I should have been creating memories with my papa, I was emotionally disconnecting from him. HD had turned this previously gentle man into someone who beat my mama black and blue. Someone we always need to keep a phone nearby in case we needed to call 911. Before HD, my papa was a man who stepped in as a father figure for my dad, a man who drove across country to wherever we were stationed. A broken system would send my papa to Central State Mental Hospital. A broken system that didn't have the ability or facilities to care for someone with HD because he could be a danger to himself and the staff. A broken system ended with my papa passing away and my mom spending 5 years in court battling to settle those bills. Fast forward to 2015, the third generation, a second path, and another interaction with a broken system. My mom, Marcia, is what you would describe as a ray of sunshine, the type of person to never say a harsh word. My mom decided when my papa was diagnosed with HD that she didn't want to be tested. She wanted to live her life to the fullest, and when it was God's time, he had a plan. My mom had hope. Hope she didn't have the disease, hope there would be a cure, but honestly, she didn't want to be a burden, and she sure didn't want to have to take an MRI. But man, if we'd only known how valuable those results would have been. November 2015, my mom's HD started manifesting as paranoia. The less she slept, the worse it got. Eventually ended up in a psychiatric ward receiving treatment for what doctors thought was schizophrenia. 30 days it took to get her home. 30 days we drove to Louisville to see her for 1 hour. 30 days I watched my dad's heart break each time we had to leave her. They didn't understand she was experiencing the progression of HD. Over the next few years, her health slowly declined. She went from being a top real estate agent in the county to needing help calculating figures. She is no longer able to drive. She is losing control of her swallowing, and she has mentally declined to childlike behaviors. So my dad and I always make sure to be nearby. November 2019, we applied for her Social Security disability income. It was declined. We appealed. It was declined. We hired a lawyer, and in March of 2021, a broken system finally awarded her SSDI and Medicare coverage. A fourth generation, a new approach. In 2018, I chose a more hands-on approach. I wanted to have all the facts and all the options. There was a fear of medical insurance finding out. There was a fear of life insurance finding out. So after I got all my affairs in line, I was able to do genetic testing off the record. The results came back. I had HD. I was tired of living in fear, and after the battles my family had faced, I decided it was time to help make a change. I now have an amazing team of doctors and nurses on the record. I participate in clinical trials, and I help with advisory boards. And I'm here to help fix a broken system. I urge Congress to take the following steps to help patients and families living with Huntington's disease. Pass the Huntington's Disease Parity Act this year. The HD Parity Act eliminates the Social Security, disability insurance, and Medicare wait periods. As you can see from my family's story, HD families often spend years securing a disability determination, then are forced to wait another 6 months to receive SSDI cash payments and 2 years for Medicare coverage is unacceptable. This policy must be changed. Expand the focus of the NNCSS to include Huntington's disease, and require the FDA and NIH to work with companies that are researching HD cures to design trials that recognize the uniqueness of HD, that the disease onset and progression is different from many other diseases. The HD community needs more research and cures as possible.
It sounds like your family had a difficult time getting your mom's disability application approved, and that it felt like the system was uninformed and didn't understand HD. How did that impact the experience with your family?
Yeah, so the disability process was very difficult and frustrating. It took 16 months to finally get my mom's application approved. She was denied 2 times, and it wasn't until we hired a lawyer that she was finally approved. Luckily, because we involved a lawyer, the judge backdated her eligibility to receive her SSDI and Medicare right away. However, I know from other HD families who cannot afford a lawyer, it takes much longer to get approved, and then the waiting periods still apply. Many individuals and families, including mine, try to support the HD patient so that they can work as long as they can and try to prolong progression, maintain income, and health insurance through their employer. So by the time that they've applied for a disability, they really need it. Making them wait years to get through the process and even longer wait times is unacceptable. HD is a devastating physically, emotionally, and financially. Not receiving the SSDI payments or access to the Medicare immediately is an added hardship that HD families should not have to endure. That is why I'm asking Congress to pass the HD Parity Act. HD families need your help. Most people have not heard of Huntington's, and even those who have don't really understand it. That was our experience with going through the SSDI process. While we learned that HD is on the Social Security Administrative Compassion Care List, it did not seem that anyone understood HD or applied compassion to my mom's case. For HD patients, their limitations may not be obvious to someone who is physically disabled. The first symptom that many HD patients experience are cognitive and behavioral. Uninformed staff and judges deny the application because they don't understand the way HD impacts a person. For people like my mom who do not want to get tested to confirm they have HD, makes the disability process even more challenging. Disability staff and judges need to be better educated about how HD to ensure patients get their disability termination quickly. I would recommend requiring the SSA to consult with HD Center of Excellence. The providers and staff at the Center of Excellence are true experts. However, even if it only takes 6 months for an HD patient to get through the SSDI process, the existing wait time still delays the Medicare coverage for 2 years.
I've been interested in Huntington's for some time because there was a family. Now there are 2 families that I'm aware of in my community that have Huntington's. One of whom, the first family was, I was good friends with the children of that family and knew the mother who died of Huntington's. This was all, of course, a lot of this happened before they had testing available. As a result of your testimony, I have instructed my staff to sign me on to HR 2050, which is one of the requests that you made, and thank you for your testimony today.
Thank you so much.